Together with other students from the PhD program, we did a stage in the Service of Neurology and the Neurovascular Unit of the Hospital of Latimán. In this stage, what we did was observing some activities that they do there normally, like the follow-up of the patients in the consultations, the patients that are living outside of the unit, the clinical visits of the patients that are staying in the unit. We saw also some emergencies and how do they react in these cases. And we saw how are the procedures for a clinical essay and also a meeting of all the staff of the department. The experience was very good. All the doctors were extremely nice, very open, and always asking us if we had any more questions, and very willing to explain all the examinations that they do and their work in general. It was very agreeable. Nice. I was surprised by the multiple sclerosis patients. I saw that they had a very accepting vision of their condition, and also I didn't know that with the new treatments you can almost stop the progression of the disease. And so I wondered, I had a very different idea of multiple sclerosis based on what I had learned at university. So I asked one of the doctors why nobody told us about this, but he explained me that it is true what is sometimes said, that the communication between the clinical practice and the science is not necessarily fluent and easy. I would definitely recommend it. For example, my thesis is on neuropathic pain and spasticity after a spinal cord injury, and right now I may be the only person in my group that has ever seen spasticity in a human patient. As I said before, this information is hard to get, and I think that's why a stage like this can be very fruitful and enriching. Because when you know how are things done in clinics, what can you do and what can you not do, and what things are they trying and what things are working, I think it can help to focus and direct research and also make better hypotheses and better models, especially in applied science. I don't plan to study medicine, and I think a stage like this can be interesting and good for any student, even if you are not interested in going into clinical practice itself. So I would recommend this stage to all the students, with just one comment, which is that obviously the patients speak in French, and most of the activities that we do are consultations and, well, seeing patients that are staying there or seeing patients that are living at their home and they come for the medical visits. So if you don't have a good understanding of French, the stage probably will not be very fruitful. But the service also has the staff meetings, which are conducted in English and sometimes are open to PhD students. So the problem with this is that they are not generally announced in advance, so if you're interested you will have to be attentive. But I think this can be also a good opportunity to see not their actual work, but in this type of meetings they discuss the difficult cases and they talk about the tests that they do, how do they decide which treatment to give and how is it working. So I think if you cannot do the stage itself, which is better because it's in French, it can be a good thing to do in its place. I want to thank all the doctors of the Service of Neurology and the Neurovascular Unit of the Hospital of Latimán, and also the patients that allowed us to be present in their consultations and their medical visits. I think this stage has been very valuable and I enjoyed it a lot. So, thank you.